Hi, this is Yazabul, live from SCAI 2019. I'm pleased to be joined by Dr. Derek Williams and Dr. Jamil Aboulhosn. Thank you so much for joining us today.
Thank you.
We're going to talk a little bit about adults with congenital heart disease. Dr. Williams, tell us a little bit more about this very specific patient population and how difficult it is to transition from the pediatric aspect to the adult cardiologist, and what are some of the pitfalls and the gaps that you face in your clinic every day?
Sure. Yeah. Well, I would just say in general, in pediatrics, transitions of care to that adult age and the new teams is a model that's still up and coming. I think it was around the year 2000 where the number of adults with congenital heart disease exceeded the actual number of kids. And so there's been a large emphasis on really structuring the care of these patients. And then the timing of when you kind of transition from your pediatric care team to that team is something that's ongoing. But I think most of us in this field begin to think about that kind of at the maturity level of the patient. So I think we all know that maybe our female patients tend to go through maturation a little earlier. They start to face some of those issues with the ability to get pregnant and those kind of things. And so probably somewhere for them in that 11, 12, 13 year age, we're starting to talk about ownership of your disease. Your parents have brought you a lot to your visits and stuff, and getting them to understand what their disease is, and then some of the factors that could affect their overall health as they transition to adulthood, and for the boys maybe a little later. And then part of that process too is separating the parents a little bit from being the sole one responsible for their care, and trying to get them to take more ownership.
Dr. Aboulhosn, in terms of managing these patients, can you tell us a bit more about who some of the key players in managing these patients? What kind of care do they require?
Sure. Well, the key to the management of congenital heart disease in general, but specifically adult congenital heart disease, is a multidisciplinary team that involves stakeholders from the pediatric world as well as the adult world. It really is a very unique field in cardiology in this way, in that it doesn't truly belong in one department or another. It by necessity requires the contribution and involvement of multiple specialists. The adult congenital cardiologist is clearly at the center of that care, but in order to get the patients to the adult congenital cardiologist, we have to have appropriate management in childhood, and then we have to have programs in place to appropriately transition and eventually transfer those children, young adults, based on their level of maturity, based on the infrastructure in place, depending on where you are, to adult care. So, and that can happen in various ways, but you really need pediatric cardiologists, you need trained adult cardiologists with training in ACHD, you need mid-level providers, nurse practitioners, physician assistants, you need mental health professionals. This is a patient population that, these people didn't pick their heart problem. They were born with heart problems, and oftentimes the kinds of patients that we take care of are the ones that were born with really complex forms of congenital heart disease and may have had numerous surgeries by the time they're 10 years of age, and that takes an emotional toll, that takes a cognitive toll, that takes a financial toll. So you can imagine that in order to truly care for this patient population, you have to have an entire system in place to do that. And that is why there are efforts in this country, in the United States now, to accredit adult congenital heart disease programs through the Adult Congenital Heart Association. And as of now, we have a total of 30 accredited programs. And what does that mean? These are programs that have all the bells and whistles, that have the processes and the procedures and the staffing in place to take care of this really complex population.
And these programs, and they're entirely funded by the government, or are there external funds as well?
Well, I can say one thing with absolute certainty. None of them are funded by the United States government. Zero. So no, these are programs that exist mostly within large academic university centers, but also large community practices that can have such programs.
And they've really sprung up because of the need, and so it's out of this great need, and the recommendations which came about in 2008 just were revised this last last year, come to the conclusion that the best care models happen with probably like that kind of spoke and hub type of model where you have a regional center that can offer that complex care, but also we know that the traveling isn't doable every week or every month. So it's really connecting the pieces that make sure that all their care is taken care of in a proper manner.
Yeah, and we have a lot to learn from other countries that actually do this very well. Countries like Canada, the Netherlands are great examples of countries with, populations not as large as ours, but large populations where patients are followed from infancy through adulthood. There is automatic transition and transfer. So there's a lot less in the way of loss to care and loss to follow-up. Where our patients run into the greatest trouble is in late adolescence and young adulthood. When you're 16 and you're feeling pretty good, or you're 18 and you're feeling pretty good, last thing you want to do is go to the doctor. And so, your mom or your dad may end up forcing you to go, but when you get a chance, you're probably not going to go on your own unless you have the proper education and understanding to bring you back into care. So that, again, goes back to what Dr. Williams is saying here about that education that needs to start really at around 13 years of age. Transition does not happen at 18 or 21 years of age. That's a really important message for our pediatric cardiology colleagues. Please, transition education must begin in adolescence and early adolescence, not at 18 or 21 years of age.
Great.
Okay, well, thank you so much. Thank you so much for joining us, and thank you all for listening live from SCAI 2019.